Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Because we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
We've got the Booyah shoulder impingement exercises to stop pain and start pain-free movement. This is an entirely new program that we've invented, and we've also created a tool to use.
Oh yeah, this, I use it for almost every shoulder that comes in the clinic. They work wonderful.
Every shoulder patient.
Right.
You don't want to objectify a person.
Yeah,
it's a shoulder patient.
More than just the shoulder that comes in.
Yeah. And by the way, this is called the Booyah Stick. And Booyah was an acronym, but we kind of moved away from that.
It's a pretty long one.
Yeah. Booyah is an expression of joy, and that's what your shoulder is going to be expressing after you use this, because it's going to get better, especially with impingements. It's going to definitely help with that.
Booyah.
Booyah. By the way, this, just to give you a little description of this, it's got 2 tips on it, so you can use it as a hiking stick too.
Sure.
It does come apart, so you can bring it along with you on an airplane. You can put it in your suitcase.
Right.
But I would suggest is that you keep it together and you walk through the airport with this thing. And then when you see other people with a Booyah stick, you tip it towards them and you go, Booyah! That's the Booyah! So,
we better get on with the program.
All right, we better get on with the program.
There are some people out there, Bob.
Oh yeah, by the way, if you are new to our channel and you haven't run away yet, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, go over to Facebook, Bob and Brad, Booyah! And like us, because all this week we're giving out positive vibes to those of you who like us. We
there
like
you go.
All right.
Impingement. We all know, well, hopefully, you know, we're aware of impingement. We're talking about right here at the top of the humerus and the acromion bone. When
watch my finger, how it gets pinched. Ow, ow, ow.
Yep.
So we're trying to create more space there.
Right.
And that's where the stick comes in handy.
Right. It really is a nice tool for this. First of all, if you ever had impingement and you went to the doctor, this is one exercise that a lot of doctors will tell you to do. And then after this one, they'll say go to the therapist to learn the rest. And it's either the pendulum or the Codmans.
Right.
Same exercise, different name. But with the stick, it's nice because it gives you something to balance on. Because I have people, they'll come in and they'll say, I'm supposed to do this. And, you know, it's okay, but if you got a sore back, which, you know, a number of people do, that is a little cumbersome. But if you got a stick or a cupboard, it just makes it nice. It gives you something to rest on. You can relax more, which is important.
So obviously he's working the right arm, not the left arm.
Good point, Bob. Yeah, I'm glad you clarified that, because this arm is the one. It's just a relaxation exercise to relax the shoulder and let it calm down.
And you can go forward, back, side to side, circle one way, circle the other way. It's just, again, to start getting things, blood flowing, get it to calm down.
Right. It's one you can start early on, typically.
Should be pain-free.
Right.
So the next one is where this really comes in handy. Should I show this?
Yeah, you go ahead, Bob.
So this is a mulligan technique, but it's a little different now because we got the stick, which really helps. So one of the things that helps set the shoulder down and create more space for that supraspinatus tendon, especially, to come through, is when you grab onto a surface like this, and I'm pushing down with my arm.
Right, like you're going to try and push your stick into the floor.
Right, so I'm pushing down, and as I push down, I walk away from it. And this should be pain-free, by the way. If it hurts, you know, maybe try a little bit lower on the stick, or try repositioning, or don't go out as far.
Right.
So I'm pushing down, I'm pushing down, I'm pushing down. Now watch what happens here, Brad. I'm right here.
Look at
now,
that.
if I were to stand up, look at that. It's a tricky way of getting motion.
Sure.
But it's also working those muscles. It doesn't work for everybody, but I say a large percentage of people that I have, it works for. So you know, you can do a good set of 5 of these, and you can do them throughout the day.
Right.
I mean, these aren't something we want you doing once a day. These are things you want to be doing 4 or 5 times a day.
Right.
Maybe 6, 7.
If you get really good responses from it, you know, it's like, wow, it doesn't hurt at all, and I do that, then you're really going to hit it hard. You know, if it's not ready for it, like you said, you might need to wait a few days.
Right. All right, the next one, Brad, actually is based on the work. Do we got the book?
Yeah. Oh, yeah. I think we got it right up here underneath this little hootenanny.
So we've done quite a few videos on this already. It's Dr. Kirsch, right?
Yep.
And he's an orthopedic surgeon, and he came up with this idea of using hanging to actually help create more space for that subacromial space.
Right.
And the problem is a lot of people don't have a pull-up bar.
Right. So, you know, if you don't happen to have one of these handy at home, some people do, a lot of people don't. You can use a stick to get similar forces on the shoulder, and very similar. And what you do is, in a seated position, you could do it on a bed, you could do it on a chair. You're going to put the stick on wherever you're sitting on. You're going to reach up, and then you just lean into the stick and stay relaxed, and you'll get that pulling, that hang.
Get that traction.
Yep, right on that shoulder. Boy, you know, and it really stretches all the muscles of the latissimus dorsi there. You're getting that nice stretch there.
I think this is golden, Brad, because you know this is an easy way for you to, you know, you can do it at the office if you need be. I mean, you can do it anywhere where normally you need a pull-up bar, and he has found this to be a very effective method. And you know, so you can lean to the forward or to the side, right?
Yep.
I mean, you know, maybe do both. But you're really going to get some good traction on there. And I mean, the thing is, you can hang on there for, I think, longer than you can normally on a bar, because a bar is a lot heavier with, you know, with a lot more body weight.
Right. Yeah, you can control it really nicely. I think this is a good maintenance exercise. Even if you don't have impingement and you don't want to get it, this would be a great way to do it. It just feels good. All right.
All right, Jen, now we're kind of mixing techniques here. Now, this is part of the McKenzie technique.
Sure.
These are therapists that are famous, and they're actually notable for lots of things. But one of the things movements that McKenzie has you work on is extension right away. So you can do this in a number of ways. Sure. One, you could put it like this, Brad, and actually go like this, and work on it. You're extending the arm. Right. But probably the simpler way is this way, isn't it? Just to go back like this.
There you go.
Right. Thumbs down or thumbs up?
You know, it depends on how the person responds. A lot of times I'll do thumb down, but it depends on the individual.
So I'm going straight back like this, and you're going to go kind of pressure on, pressure off. You want to stay within a pain-free range.
Right.
I mean, you don't want to be pushing and creating pain. Right. But you can bump up against the pain.
Right.
So
just to clear, it's not out to the side like this, but it's behind you. That's the range. We're going to work the other one too, but we're working on extension, which is behind you.
You're often going to find out that your involved shoulder probably doesn't go as far as the other side.
Right.
I mean, your involved shoulder might only go this far. You know, your good shoulder, non-involved shoulder might go way up that high. So you want to get them even. And again, you can do a set of 10 on these.
Sure.
And you can do these every hour if you want. But it should be pain-free.
Right.
And it should feel better afterwards.
Right.
I don't want it feeling worse afterwards.
Right. Work it gently, and you know, particularly if the first one hurts, but it starts to feel better every one after that. By the time you do the 10th one, it's higher and feels better. Typically, a real good sign, green light to continue with them.
Again, this was another way. Some people just, you know, put their hands up there and bend down like this.
Right.
And it's just a different way of putting pressure on it. So.
All right. Well, Bob, I want to continue on. We might as well go right out to the side and do some abduction. Now, abduction is one when I work with people with impingement. I usually wait till later on in the recovery. Things are feeling pretty good.
It is usually one of the last ones to come.
Yeah. But you can squat. You can see it's getting higher with the arm, or you can lean into it. This kind of depends on the person.
Or you can go like this.
Right.
So you got this one thumb up, this one palm down. And you're going to just work it going like this again, pressure on, pressure off. I mean, this is usually the last one to come back a lot of times, it seems like.
Usually, I'll work flexion, this one, straight up in front like this, or similar to the mulligan technique Bob had showed earlier. But usually as flexion gets better, abduction follows. Typically, is that your experience?
Yeah, absolutely. Yeah. And I would also say, you know, you don't need to do all of these in one day.
Right.
You're going to pick usually one or two that you're going to do. That's all you're going to do. So you can start with the Codmans, you know, and then you're going to probably do this mulligan one, you know, and that's probably all you'll do that day.
Right.
I mean, you'll do it a couple of times. And then, you know, you might throw the hanging technique. You might do that one for a couple of weeks where that's all you do.
Sure.
Is the hanging technique.
You're going to do the ones that feel the best and get the shoulder moving with less pain. So you got to work with your body and be smart with it. I did want to mention this one too,
External
Bob.
rotation.
Yep. Where you just say, this is my good pain-free arm. That one's going to be doing the work. This one is going to go for the ride. Now, I
So
did
he's
want to.
got the arm in the side. He's got a right angle here, and he's working on external rotation
Right.
here.
Which is oftentimes limited with impingement.
Right.
It'll come out to here and start to be painful. And if it's pretty painful yet, I'll start this one in the supine position, and it allows
That
your
means
arm-
on his back.
Yep, it allows the shoulder to relax, and you can go there. And once it feels better there, you know, you can do it seated or standing. Same motion, different plane in the body.
Should probably show internal rotation too, Brad.
Sure.
So with internal rotation, what you're going to do is I'm going to go ahead and work on pulling the lower one up. So this one's doing the work. So this is the involved shoulder,
This
the
is
left
the
one.
injured one.
And so I can pull it up my back further and further, way up like that.
You know, if it's early on and this one creates any sharp pain, you're going to hold off on it. You know, again, try to work pain-free range of motion.
What you're going to see normally, again, the involved shoulder, let's say this is the involved shoulder, it might go up this high, and your better shoulder, you're going to go up this high. So you're going to want to get this one up there
Sure.
eventually. So
Yep, so we get that shoulder working so you can scratch behind your head, your back, throw a 100-mile-an-hour fastball.
women can put their bra on.
That's a good
Yeah,
point.
no,
yeah.
it's a big thing.
It
so.
is, really.
So we have this listed down below in our products, Amazon products, but we'll have a special link right to it too. I
Sure,
think, so.
okay, you bet.
All right, everybody, thanks for watching.
Booyah!
Booyah!